The impacts on Oklahoma from the Republican health care plan are becoming clear. While the projections are only estimates, even a special report prepared for Governor Fallin by her staff shows that billions of federal dollars will be lost and thousands of Oklahomans would lose health care coverage.
140,000 Oklahomans are currently enrolled in health care coverage through the Affordable Care Act. More than 819,000 others are on Medicaid. Under the GOP health care plan, Families USA estimates that 313,000 of those people will lose health care coverage. $9 billion in federal funding for health care programs and subsidies would also be lost. Carly Putnam is a policy analyst with the Oklahoma Policy Institute, specializing in health care. She agrees the GOP plan would not be good for Oklahoma.
It's going to be bad for low-income Oklahomans. It's going to be bad for moderate-income families who have used the marketplace to purchase coverage. There are a handful of folks who come out ahead, but by and large, I don't see a way where Oklahomans benefit from this plan.
Putnam says especially for people in rural Oklahoma, it's hard to see how many could keep their health care coverage.
For a low-income 60-year-old Oklahoman in a rural county, they could look at seeing the cost of their health coverage go up to more than they make in a year.
Data compiled by the Kaiser Family Foundation shows just how much the finances of health insurance would change for rural Oklahomans. As an example, in Woodward County, a 40-year-old making $20,000 a year would lose over $4,700 in tax credits. But a 60-year-old in the same county making the same money loses more than $13,000 in tax credits. The Center for Budget and Policy Priorities puts Oklahoma at third highest on the list of states losing the most per person at over $4,600. One of the few bright spots in the comparison between the two plans is that because Oklahoma did not expand Medicaid, cuts to that program won't be felt here as much as elsewhere.
Some small pieces could be positive for the state, but that's a little bit like getting new drapes and then setting the house on fire.
The GOP plan is facing such opposition even within the Republican Party that its future is iffy at best in its current form. For that reason, many of the organizations that represent health care in Oklahoma declined to talk about this issue on camera. The Oklahoma Hospital Association says, "We are still studying the new plan bill and what the potential impact could be on Oklahoma, so we don't have an official position yet." The Oklahoma State Medical Association, which represents doctors, says OSMA believes it's best to decline interviews at this time due to the fluctuating nature of the debate over health care coverage in Washington. The Oklahoma Health Care Authority also declined, saying Oklahoma would experience a lesser impact than the Medicaid expansion states. However, a report prepared for Governor Fallin by her own staff finds that health care could become unaffordable for many low-income Oklahomans, especially in rural parts of the state. That the state would lose $9.3 million just in public health funding, and the GOP plan creates a huge subsidy cliff between Medicaid and the individual market, leaving the cost of insurance unaffordable. Carly Putnam says something backers of the GOP plan have claimed all along really is not correct.
Something the CBO report, the Congressional Budget Office report, said that other industry analysts have been saying for a long time is that the Affordable Care Act's health insurance markets aren't in a death spiral.
The New York Times did an analysis of the death spiral claim and found that the premium hikes impacted about 3% of Americans.
Which for those 3% was undoubtedly quite painful, and I feel for them. But the amount of press that those headlines have, that those premium spikes have gotten relative to the number of people who actually, were affected by them is kind of out of proportion.
There are lots of ideas on how to fix the Affordable Care Act still floating around the halls of Congress. What, if anything, finally makes it into law and how it impacts Oklahomans still really remains to be seen.